Hi, I'm Ben and I'm from Hands2Heart Massage. And today I'm going to be talking about lower leg injuries. Lower leg injuries being from the knee down to the foot. I just won't focus on that area in terms to help prevent it or help get it recovered a little quicker, but I will be talking about injuries in that area. The three main ones being plantar fasciitis, Achilles tendinopathy or tendonitis as it's known, and calf strains or tears. Before I get into prevention or how to recover from them a bit quicker, I'd like just to go into why they occur. And for me there's two reasons why they occur. The first one is a breakdown in the kinetic chain. And what I mean by the kinetic chain is if you're doing a sport like running or a jumping sport, soccer, football, athletics, to get into a position to take off, you'd need to get into that position there, which means that you need range of movement in the calf into the Achilles, which attaches into the calf. The bottom of the feet needs to have a certain amount of flexibility, even into the toes. If there's a breakdown in that kinetic chain, if there's less flexibility in one of those areas, then it's going to compromise or make the other areas in that chain do a lot more work, hence bringing a tear or a strain or an overuse injury. So that's the first reason. The second reason is biomechanics. And there are a few biomechanical reasons why you might have a breakdown in that area, but probably the biggest one I find is pronation. And if we look at why pronation occurs, it could be just due to foot mechanics, but more likely than not, from what I've seen, it's due to the lack of stability through the pelvis and through the glutes in that take-off position. So people go to take off and their knee will track in, causing pronation and causing one, if not three of those issues that we've just discussed. So a big one there in terms of preventative for injuries, if that's the case, and a good test you can test yourself to see how strong you are through that area, is just a single leg standing test. Which is just standing there and doing a squat. Now if you do this and your leg is wobbling around all over the spot or tracking inwards like that, it means that you're probably a little bit weak in your core and your glutes. You might want to do some work before you start upping your miles, or if you've already got a little bit of a niggle there, maybe backing off and working a bit on your biomechanics. A longer term sort of fix is a set of orthotics or a pair of shoes that stop you pronating whilst you work on that. So you might want to get a pair of orthotics to help you support your arch, or a pair of shoes that stop you pronating, and by doing that you're able to continue to run because they'll give you that support, but you really want to work on these areas and actually maybe look at then removing those tools in the long term. So let's go through the first injury, and some of these things that I'll do, I won't repeat myself, they'll actually work for one or more of those injuries, but I'm going to look at plantar fasciitis to start with. And in your fascia, where your plantar fascia is through the bottom of your foot there, through the arch of your foot. Now, by the time you've got the injury, you'll feel it, there'll be pain through the bottom of your foot, generally more once you've cooled down, or when you wake up in the morning, you might be like walking on eggshells and it actually warms up, and once it warms up it's okay. The more chronic is even just walking you'll feel it, running you'll feel it, and it'll actually inhibit you in those sort of movements. So to stop that, there's a few things that I like to work on. So these things will actually help whilst you've got the injury, as well as beforehand. So if you're thinking of upping miles, these are the things that you might want to look at before you start to help prevent it. So the first one's a trusty tennis ball, and it's just simply rolling through the arch of your foot. You're going to feel tender spots. So if you've never done this before, and a lot of people ignore the bottom of their feet, you might get a surprise at how tender some of the points in the arch of your foot is, or in the fascia at the bottom of your feet. If you find one of those spots, just spend a little bit of time on it, hold on that spot for 10 or 20 seconds there, allow the fascia to melt and release a little bit. Now, if you've experienced that and you think, oh, I'm not getting too much out of the tennis ball, or that you've already got a bit of tenderness there, and that's not quite doing it for you, then I'd suggest a rolling pin or something like this is a broomstick. I like it because it covers the width of the foot and it gets it all at once. So again, it's just the same motion rolling through there. It's a little more intense. but you just find those spots that are a little tender and spend a little bit more time on those. Another thing you can do if you're getting a bit of tightness through the bottom of your foot is Japanese kneeling. So Japanese kneeling is where you're kneeling on the ground with your toes tucked underneath you and you sit back on your heels like this. You may get a stretch through the actual toe joints themselves, which is a great thing. It helps with the mobility and movement there. And you might also get stretched through the arch. If this is a little too intense for you at first, you can come forward to take the weight off, or even further forward still and work your way backwards over a week or two. You don't need to spend a lot of time here. A minute to 2 minutes a day or every other day is fine. You don't need to sit here for 5 or 10 minutes to get a stretch on that. If you've actually incurred the injury, massage obviously is a great benefit through that area, just to help with the muscle fibres and circulation through. Well, it's not a muscle actually; it's fascia. It's like a sheet of collagen, just to line those fibres up and to get some circulation in the area, break down any of the adhesions that are there. Another thing you can do is get some physio tape, and you can take through the arch and get some support through the arch to help the plantar fascia get some support while you're walking or while you're running if you want to continue your sport, and it's not too bad. Again, if it's really painful and when you're running it's hurting, don't try and push through it. See a physio, see a massage therapist to help get some help in that area. Heat also, I like heat in the area just to get blood flow, just get the tissue softening up. So if it's really painful and you're trying these tools, heat it up maybe with a heat pack first of all, and then try that. You'll get a lot more movement out of the bottom of your foot and it'll respond a little bit better than if you were to do it cold. The next one's Achilles tendinopathy. They call it tendinopathy now, not tendinitis. So that's where your Achilles, which is this part, meets into the heel or the calcaneus of your foot. You might notice it's a little sore after a run. As it gets worse, you might find it sore to touch, you might find it red, you might even find it that it's swollen. Once it gets to those stages, it's a lot more advanced and you have to be really careful, because once your Achilles actually partially tears or ruptures it's quite a long process to get that recovered. So if you're finding you've got a bit of heat in there, it's even sore to touch, I would back off the volume that you're doing, just so that you don't end up rupturing it, because that would be the worst case scenario. For Achilles, I only like light stretching. I don't really promote heavy stretching on the calf or the Achilles with tears and Achilles injuries, simply because it's caused due to pulling or due to moving through a greater range of movement. So if you've got a tear or if you've got an Achilles issue and you're already doing vigorous stretching on it, it's actually pulling on that attachment, which is aggravated. So light stretching is good. And imagine this as a step, like a step at home. So what you want to do is just do a light stretch, and that's just dropping the heel down past your toes, just slightly where you can just feel that stretch, and that's as far as you want to go with it. Again, I don't promote it a lot, but a light stretch is okay, just to keep that range of movement. The other thing I like to do with Achilles is actually, I'll put the roller away, but to use the roller through your calf. Again, that stuff through the bottom of your feet is really good at all times. Because of the fascial network, or just working through the bottom of your feet with a roller or a tennis ball, it's actually going to affect your calf and your Achilles as well. So do that in conjunction with this. So likewise for calf tears and strains, this will go for both. And this is just simply using a foam roller, which you can get at Rebel if you're not sure where to get one. And rolling through the Achilles and the calf. I tend to like to put one foot on top of the other just to get a little bit more pressure. If it's too intense, you can take that off and just use one leg. And just start at the heel where the Achilles is and roll slowly through the calf, through the bottom of the calf, which is the soleus, right up through to the gastroc. The Achilles actually attaches in through that area. And when you roll that, just roll through the middle of your calf. Rotate your calf to the outside and roll that. Rotate your calf to the inside and roll that. And again, with with correct taping methods, you can get support for your Achilles. So if you know a good physio or massage therapist that uses physio tape, this is rock tape, this branded physio tape, you can get the taping actually up and through the Achilles to help support it, to give it some proprioceptive feedback, and it's actually a good tool to use. Ice straight after running. Obviously there's swelling in the area, so you want to put ice on it. It's good to do that if you want to continue running and it's only a little bit aggravated. The other thing with taping as well, and going back to the biomechanics with Achilles, a big reason why it happens is when you pronate, that Achilles actually bows in towards the centre. So imagine your Achilles is bowing in this way every time you pronate, increasing the distance between where it comes up into the calf and your heel. So if you've got someone that knows how to tape it, a physio or again a massage therapist, you can go on a run and you can actually tape it from this way outward so that bowing doesn't occur, or at least reduces it a great amount and takes the pressure off it when you're running if you've got a biomechanical issue. Again, these are things, being an athlete, these are things that you want to continue to do your sport. Err on the side of caution. If it's getting sore to touch, you need to stop. You need to have a look at what you're doing or the range of movement in that kinetic chain, otherwise you're going to do greater damage. Okay, that moves on to calf strains and tears. A strain, you'll know, is just a tightness in the calf. It won't stop you running, but it'll give you a bit of a worry and it'll make you apprehensive. A tears comes in 3 grades, a 1, a 2 and a 3. If you get a grade 1, you might feel it a little bit at the time, but you won't stop you running. You'll feel it when you cool down, maybe the next morning, and you won't be able to sort of move through the right range. A grade 2 and 3 will have pretty much instant pain and stop you from doing your exercise. Might be accompanied by bleeding or bruising if it's severe. So obviously when you get a calf tear, you want to put ice on it within the first 24 hours. Just to reduce the inflammation in the area. It's always, you know, the rise, the rest, the elevation, the ice and the compression. That's good if the injury's already occurred. If it's just a strain, again, rolling will really work. You can also get taping to help support the calf, and that's the same with a tear, and depending on which grade, taping can help just to stabilise and decompress the area. If you have a tear, after that 24 hours, actually promote some heat in the area. Heat brings blood to the site, so if there's a tear, it helps the blood to get in there a little greater, which helps get the rubbish out of the site, also helps with the nutrients and the laying down of the new collagen. Again, massage is really good because when muscle fibres tear, they tear and they just lay down, however they come back together. It may be like this or like this, but massage actually helps those muscle fibres line up and get in line with how the muscle's moving. So yeah, it's just a greater repair to the muscle at that stage. If you're getting tightness in the calf and just a bit of the strain, one thing that you can try is calf guards. Really good from experience. You can run in them, even better. I like to sleep in them, even for the whole leg, quads and that sort of thing as well. They really bring about lymphatic drainage and circulation. And if you're getting sore calves after a session, it's good just to wear them to bed, wake up the next day, and I think you'll find that your recovery is a lot better and your calves is able to do a little bit more than what it was previous. You'll get a bit more recovery out of it, so you might be able to run 2 days in a row if you weren't able to previous to that. Let's hit on the calf tears and the strains. The last thing I'll go into, again in that kinetic chain. So that's part of it. As you can see, your hamstring also needs to work through a range of movement. If it's tight, it'll bring you back, and then your calf and your foot have to do more to get you in that takeoff position. So a good one I like to use is just a chair and a trusty tennis ball again. Now when I'm talking about the hamstring, you've got 3 of them on each leg. So one that runs down to the outside of the back or posterior of the leg, one down the middle and one down the inside. So when you use a tennis ball, don't just work down the middle or the outside, move it around and find which hamstring is tighter. So it's just a matter of just sitting on it, on that hamstring, and slowly extending and flexing the knee, or straightening the leg, and moving it around, and you'll find the spots that that need trigger pointing, you'll actually feel, and the ones that don't, you won't really feel much at all. So just move that around. That'll actually help with the kinetic chain, help from the hip right through down to the bottom of your foot to get you greater flexibility in your hamstring and help you with that takeoff position. That's it for me today. We've just covered a few of the things that you can do to help prevent, help recover quicker from an injury, and a little bit of why they occur as in the biomechanics. So I hope that's been a help to you. I'm Ben from Hands2Heart Massage. Bye for now.